Well, greetings again. This morning I want to cover something that we did a video on here just recently on class 3 correction by taking out lower 6-year motors. And this one case we had in there that had finished, I talked to the young man. He really needed to have surgery. They had to go up and shorten the upper of the maxilla and close this down, and he would have had a normal facial height in here, but he has it's quite a bit over the length of it, and it messes up the way it appears. But the young man didn't want to go do the surgery, or else he couldn't do it, and he said, if you can't do this, then I'm not going to do anything at all. It was a lot worse. So I went ahead and did it. I want to run and show people that I don't normally put up something that I didn't want to do really like that. But I didn't want to leave the young man like this, because I knew I could straighten that out. It wouldn't cost him just a fraction of going in for surgery. And to reduce this, they take the whole maxillary teeth loose, and they go up under the sinuses and trim the bone off about sometimes 6 or 8 or 10 millimeters of bone that's in the sinus, and just take it out. And I have scrubbed in the case like that, and that is difficult to, but they've got it. The blood supply comes from the soft tissue behind this, and you see somebody with their front teeth out here over their mouth like that, held over by the posterior tissue. You sit back there and you say, God, I hope that you know what you're doing. This will heal up, but it will do that. But let's get on with this case now. I did it like I would a normal height face, and so we took this case down and we did the 6-year motors. This 6-year motor thing works now, but it doesn't shorten the face like you can do with the surgery. But we can do normal facial heights with the 6-year motors just as good, and you get a double jaw result out of that by you bring this group of teeth back where you want it, and you put these pins in here and holds it there, and now you wear class 3 elastics, pulling on this and bringing the upper jaw forward to make room. In other words, you bring this in where this looks good, and then you put pins in it here, and now this part won't move back any further, and now we go up in class 3 elastics. Well, you can go way on out here and bring these teeth out and fill this in on the outside if you wanted to, but you could make the profile come back here. But I cannot shorten this distance in here with this type of correction. In other words, the lower class 6-year motors, removing them, just doesn't close this space down. Now you see you've got too much, with the jaw coming on about like that, so that this distance here is about like it is here. But if you close that up, then it'd be more normal looking. And that's what you'd have to shorten this up here to do that. And I couldn't do that just with the 6-year motors. But he made a decision. He said, I can't do anything else. If you don't do this, I won't be able to do anything. So we did it like that. And so you see, he smiles, and the upper teeth look pretty good in that position. Now, a young man can get away with a longer face. A young woman, if you did, she's like that. The appearance is a lot more important to her than it is. I say that, but there are a lot of men want to look good more than women. But any way you do that. We carried the case through. We took the 6-year molars out. We put this to jump the bite. We're pulling this back now, and we pull it with class 3 elastics, and that'll make these teeth come forward when you do that. And you can hold those right where they are. You jump that over the bite, and the 6-year molar, lower 6-year molars, works on normal facial heights. But if it's a way like this, you can correct the class 3 problem, but you can't correct the vertical height of the lower third of the face. And so watch that. We'll close that space up. Now we're trying to get some of the people in our AOS. I suggested that we start doing more adult orthodontics and using orthodontics to close up the spaces in there. In other words, doing restorative dentistry mixed with orthodontics. And that's what I wanted them to do. There's a lot of people lose their 6-year molars. They don't brush good when they're young, and they come in and they lose them. And if you've got wisdom teeth back here, you can pull the 2nd and 3rd molar up and close that space, and you can't tell it's done a year or so after the bone will fill in around there. And it is an excellent way to avoid the class 3 correction where you do both upper and lower jaw. So I hope that goes over. Now, let's see, here we went ahead and doing this from the bottom. I'm gonna run through. We got the case finished. We got the teeth underneath there and everything. And we closed it up. And here he ends up with the bottom teeth fitting in here. And this looks pretty good. But if you had ran this out somewhere around in here, now what we would, if you did a double jaw surgery, you would section the maxilla loose up here, and you would go in and take off a bunch of bone up this area, and you pick that up, and that would allow the chin then to close in there. Now that's a lot of surgery, and he could not do that. So don't point at this one and say, you screwed up here, you didn't get the facial height right. And this distance between here and there is too much. But we could, now you could do this, and I've done this on some patients, or had them, you could send them in and do a genioplasty back here. You can cut this off down on your lower jaw, and you can take a big chunk out of it, bring this up, and then that'll let this part of the jaw be closer. So you could do this type if you wanted to go to an oral surgeon and get a genioplasty done to help lower the facial that way. So anyway, he said he couldn't afford that even, so we did the best we could with it, and I thank you for watching, and just wanted to cover this because I stuck my name on this case, but I knew what I was doing here, and I didn't want to leave this young man with his face like it was, so we did the class 3 correction, and it looked fairly good. We took those teeth out, we pulled that together. Now the teeth are up there. And I tell you, I've gone to the dental schools and say, the orthodontics, and say, this can be done when you got the 6-year molars. And they say, we're not do that. I don't even know if they know how to do it. But this is bad. This young man is 23 and nearly on the way to 24 years old. And this was 92. we're going to try to train some of our AOS instructors that said I tried to get them to do this. They said, we don't have anybody trained to do that. So they're hoping to come out, and I'm going to go over with several of these instructors and show them this is a simple, easy thing to do. It's not that simple. It's simple after you learn to do it, but you can move those teeth and watch them come together bodily, and they'll end up like that. And you wait a year or two or something, and you can't tell that this is not they'll think they got their wisdom teeth out there, and they don't. So anyway, I'm proud that I was able to develop this method of doing class 3s by just doing the lower 6-year molars. It is an excellent way to do it, but you need to put the person's face like they want it, or if they don't, they'd have to come in and do a genioplasty and cut a big section of the chin down and bring it out, and you could shorten the face to some extent that way from the other end. And you can do the genioplasty at a minor cost. In other words, you can take this part out down here in front of the chin and bring it up. And that we could have done that for him, but he didn't have the money to go. You just look at the hospital and it's going to cost you a lot of money here. So we did this for him, and he ended up looking pretty good. And there we are after we finished the case. Now this is not perfect, but he's got too much height. And when his face is too long, if you just smile a lot and talk to people and you got your mouth open, they can't see it. They can't tell it. But here it is. It's better than it was, but I would like to just go. Now he could go in and have his chin brought back. He could do that any time. He could go get him a job, make a lot of money, and somebody could come in and do a genioplasty from the inside and reduce the height of his face here. I don't think he ever did that, but he's got a good smile. Now when people smile and they've got too much vertical height of the face, it hides it a considerable amount. So just teach them how to smile all the time, and it'll look better. And I like the guy. He's a nice young man, and I think that was better to do that. So I'm going to close it up and say goodbye. And I'll see you again, and I hope you'll join our group. We've got 3 channels in YouTube. And thank YouTube for coming along, where we could share this with everybody anywhere that can only get on the internet. And that's what I wanted to do, is to get this out to everybody. I know you can see it. It doesn't cost you anything to look at this now. And so I hope it fills in a big hole and people can see it all over the world, what you can do with this. And I thank you for watching, and I'm going to close out now, and we will see you next week, hopefully.